Well, we know that antiretroviral therapy has been an enormous success story in all the countries, but particularly in sub-Saharan Africa, where it's the epicenter of HIV/AIDS epidemic. We know that the availability of these drugs not only avoid HIV people to develop AIDS, but also this is the focus, the most important part of AIDS prevention, given that people on treatment will less transmit HIV to their partners. So really we are worried about the fact that there may be an interruption in the scale-up of antiretroviral treatment just now, when we are aware that HIV treatment is so important to control AIDS epidemic in Africa. Actually, CoBaSys tried to focus on the possibility to take care about the sustainability of antiretroviral scale-up program, focusing on a community-based approach. And this was particularly driven towards the possibility to capture the people that are more vulnerable, that are women and children. CoBaSys aim to empower and give voice to the community involved in the project Menstruating HIV and AIDS. In line with a science and technology program objective, CoBaSys created a multidisciplinary Europe-Africa network capable to discuss the assistance and cure of people living with HIV. CoBaSys network involves 6 African countries: Tanzania, Malawi, Mozambique, Zimbabwe, Botswana and Namibia, and 4 European ones: Italy, UK, Finland and Belgium.
Why the focus group were so important is because actually that was the very base of the project. The project was based on the idea of empowering communities, and how to empower communities if not with a participatory approach to the research. So our team selected some specific sites which were relevant with regards to the levels of HIV/AIDS, the specific context, the political context, also economic context, social context, and gendered as well. When they selected the local stakeholders, organized focus group, put together the population interest groups, the idea was to use participatory research and focus group to reinforce the dialogue among people in the communities and between them and local authorities, local institutions, political actors, health workers. One of the key elements emerging from all the focus group was actually the relationship between the community, people in the community, particularly people with HIV/AIDS, and the health workers. So the focus group have been functional to the implementation of the second stage of the CoBaSys project that was implemented at 2 levels, at community level and at national level. At community level, the partners used the results and the challenges and the proposals that emerged from the focus group to develop what we called an awareness campaign, which was basically based on slogans that were printed on t-shirts, on banners that were broadcasted at the local radios, and that were mostly focused on a proactive way to fight against HIV/AIDS at community level. An interesting element of the awareness campaign was that they were based on the specific priorities and needs of the communities where the awareness campaign were realized. And in fact, local communities and the groups with which we collaborated were actually central in the implementation of this awareness campaign. For example, in Malawi, one of the slogans was men, do not be shy to go to voluntary counseling and testing, in the local language, of course. And this obviously says something about the fact that stigma, and also stigma based on gender discrimination, is still a key issue at community level. At the national level, the focus groups and the results of the awareness campaign were brought together in national roundtable. National roundtable were realized in each of the CoBaSys countries in Africa and brought together key stakeholders, including policymakers, donors, civil society representatives and members from the communities involved to discuss what emerged from the work that was carried out at community level. So that was actually the stage in which the topics raised by the communities were brought at the national level. It was a very step-by-step process. And a further step was bringing this issue at interregional level through two interregional meetings that were realized, one in Maputo in Mozambique and the second one in Lilongwe in Malawi. CoBaSys was able to bring together not only stakeholders from the CoBaSys countries, but also key stakeholders at the Southern African region, including representatives from UNAIDS, HIV/AIDS parliamentary group members, regional NGOs, other donors, as well as, of course, the community members. And this was a key moment to try and discuss on the main challenges to promote a comprehensive and regional policy on HIV treatment, prevention, and care.
The present time is quite difficult with regard to the possibility to have good expectation for sustainability of the HIV program in the future. We know we are living an unprecedented economical crisis, and this is the true AIDS dependency crisis. Will African countries be able to sustain the scale-up of antiretroviral program in the future without the support or with a minimum support of international donors? This is a difficult story, and we have discussed it, especially in consideration of the need of the importance to set a private and public partnership for keeping the fight of HIV and AIDS. We had several results that were achieved by CoBaSys project. First of all, it was community empowerment, and this was obtained through a participatory research and action program. This allowed us to develop awareness campaign within the community so that we give voice to this community, and this community were able to make their voice be heard by the policymakers, both at a local, regional and a national level. This, we hope, will help to have a better definition of HIV intervention strategies within their own communities. The second result was advocacy at the political level. I think it's really important to involve community in a multi-stakeholder debate. We know that in most of these community, multiple stakeholders play a role, but most of the time they do not coordinate one another. We also wanted to promote a global research collaboration, and this especially was important in making a network, a stable south-to-south network, in particular making African institutions, mainly university, work together with local NGOs. Providing tools to improve community groups, their lobbying and advocacy power, as well as discussing specific model for community-based to health clinics. Fifth, collection of research need and identification of priority to provide the national international donors. A major role of e-health and mobile health is therefore suggested to be faced the challenges that HIV, aging, that implies the increase in comorbidity and higher specialized diagnosis will affect the community care model in the near future. We know that policymakers in Africa has really welcomed the community health support because it's cost effective. Nevertheless, in the context of an increasing complexity of HIV care, we think that this is not enough. We need to invest more money and more resources so that to be able to capture to be able to take care of HIV people in not only in first line regimen but also in second and third line regimen, as well as in the management of comorbidities. Also, new efforts should be provided to take care of the quality of life of people living with HIV, and this also needs the importance of psychological support, the importance of prevention, education, and remember, of still voluntary counseling and testing, given that really most of the time HIV is diagnosed at a later stage in Africa, and this implies that there's still a big mortality in these communities that could be avoided by an early access of antiretroviral treatment. Participatory research experience that was brought by CoBaSys really contributed to increase the knowledge in HIV and AIDS in sub-Saharan Africa, especially in bringing knowledge to action gaps between research and practice. And this was done really addressing for social justice and creating conditions that facilitate people's control over the determinants of their health.